The Secretary General established UNMEER as the first ever UN system-wide mission, the first ever global emergency health mission, and we are playing the role, first and foremost, as crisis manager, pulling all the different parts of the UN together to address this multifaceted, complex crisis. A lot of good work was being done by different United Nations agencies before UNMEER was ever created. The number one priority is to stop Ebola as fast as possible. That's really on the forefront of everyone's mind in UNMEER. It's all about stopping the disease, reducing transmissions, ending the crisis, protecting the communities, avoiding future deaths. Doing that is complicated, it's difficult, it requires a lot of effort. It's going to be very much national governments who take the lead with strong United Nations support. We're getting more and more resources, material resources, human resources, financial resources. But we don't have everything we need. We need more. We need more of all of those. We need more people, we need more material, and we need more funding. The virus, the crisis has evolved a little bit in the past month with a broader geographic spread, and our response strategy needs to evolve with that. What I'm most alarmed by, what's most disconcerting, is the presence of the Ebola virus, the disease that's killing people in remote areas that we don't yet have access to. And so as we get more and more out in the countryside, we're finding more and more cases of the disease, more communities affected. So I'm deeply concerned that the true numbers of people affected by the virus, dying of it, are higher than the numbers being reported. What is encouraging, though, is the resilience of the communities and how more and more communities are taking action themselves to protect themselves. They now increasingly understand the risk posed by the virus and are taking action to protect themselves against those risks at the family level and at the community level. I also had a chance to meet with a large group of survivors in Kenema in Sierra Leone. This is a community that had been very hard hit in July, August. A lot of people were dying from Ebola, healthcare workers were getting it, but now the situation in Kenema has improved a lot because of the community itself, because of the national government response, because of the United Nations. And there are a large number of survivors there, and meeting with them in this big group was really the highlight of the job for me so far in the 6 weeks now that I've been in it. There's stigma towards people who have contracted Ebola, even those who have fully recovered and pose no threat to anyone else in the community. They're still looked upon as sometimes people who one ought not to associate with. It's also, though, the case for aid workers, the stigma associated with having worked in that area and then returning to their home country. And it's very unfortunate. And those people on the front line should be celebrated and rewarded and thanked rather than stigmatized. I am all for well-founded, scientifically based, reasonable precautions to ensure that people who are traveling across international borders are not carrying the Ebola virus. But unfortunately, I think we've seen in some cases unfounded or decisions that were not based on science, were not based on reason and rationality, but were based on fear and hype. And those kinds of decisions have a negative impact on the ability of the world to respond to the crisis and bring it to an end where it is in West Africa.